Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: is marijuana a depressant? Is weed a depressant? Weed depressant attributes. Marijuana is not considered a depressant. It can produce a feeling of euphoria and relaxation, and can even be an antidepressant for some people. However, some people experience decreased motivation and motivation-related issues due to long-term use. So it is important to be aware of the potential risks. Is weed a stimulant or depressant? Is weed a depressant or stimulant? Most people consider marijuana a depressant, not a stimulant. Marijuana's effects can vary from person to person and depend largely on the amount consumed and individual biochemistry. Generally, marijuana can cause a feeling of relaxation and soothing effects, although some people may find it stimulating and feel energized. In smaller doses, marijuana can act as a stimulant, while in larger doses it may cause lethargy and a sedative-like feeling. Some people may experience both stimulant and sedative effects. Additionally, marijuana has been linked to both anxiety and depression. Depression and marijuana. Many people suffering from depression commonly self-medicate with marijuana as a way to cope with their symptoms. However, it is important to understand that there is still not enough research to determine if marijuana is actually effective for treating depression or if it has long-term effects on mental health. It is also important to keep in mind that marijuana can interact with other medications or exacerbate existing mental health conditions, so it is important to talk with a doctor before beginning any new treatments. Does marijuana help depression? The results of existing research on marijuana and depression are mixed. Some studies suggest that marijuana may offer relief from symptoms of depression for some people. However, other studies suggest that regular use of marijuana could increase the risk of developing depression. Therefore, it is important to discuss any potential risks and benefits of marijuana use with a healthcare provider. Research has shown that marijuana can be helpful in treating certain medical conditions, such as chronic pain and certain types of seizures. It has also been known to help with sleep issues, nausea from chemotherapy, and inflammation. Other potential benefits include reducing muscle spasticity and glaucoma. It can also be used for recreational purposes, as it can produce a sense of happiness and relaxation. As with any drug, it is important to be aware of potential side effects, such as increased heart rate. Marijuana and depression. There is not enough evidence to definitively say that marijuana is effective in relieving depression symptoms, but some studies suggest there may be benefits. However, it is important to keep in mind that marijuana can also interact with other medications or worsen existing mental health conditions. It is highly advised that anyone considering marijuana for their depression speaks with a doctor before beginning any new treatments. So where does marijuana, also known as cannabis, fit into these categories? Is the statement, "weed is a depressant," accurate? The answers are not as simple as you may imagine. The results from applying marijuana and depression together can differ greatly from person to person. Additionally, various weed breeds and varieties might have various effects. According to the University of Maryland, marijuana can be categorized as a depressive, stimulant, or hallucinogen. It is never categorized as an opiate, though. Learn more about the effects of marijuana as a stimulant, depressive, and psychedelic by reading on Depression and Marijuana Effects. Your nervous system is impacted by depressants, which impair brain activity. Together, these activities can ease stiff muscles and soothe frazzled nerves. Several disorders, such as insomnia, anxiety, or muscle spasms, can be treated using depressants. Depressants, however, may potentially have adverse immediate consequences, such as nausea, confusion, reduced motor coordination, low blood pressure, slowed breathing, slurred speech, lightheadedness, blurred vision, short-term memory loss, dizziness. Weed produces similar positive and negative effects, including relaxation, sleepiness, muscle relaxation, short-term memory loss, dizziness. Is marijuana a stimulant or depressant? While most medicines are more addictive than depressants, certain of them, such as barbiturates, have a substantially higher risk. Depressants, like marijuana, can cause tolerance over time, which means you have to take more of them to have the same effects. Is marijuana a depressant? Additionally, marijuana might lead to dependence on some things. For instance, if you smoke marijuana before bed, you can eventually find it difficult to do so without it. Smoking anything irritates your airways and raises your chance of respiratory illnesses like bronchitis and a persistent cough. This is true whether it's tobacco or marijuana. Find out more about how marijuana affects your body. Does marijuana help depression? Marijuana depressant. Depressed weed, depression and marijuana usage are frequently related. The likelihood of using marijuana is 2 times higher if you have depression than if you don't. In the United States, marijuana usage is increasing generally, but among depressed persons, it is increasing more quickly. Widespread legalization is probably a contributing factor. Does marijuana cause depression? Now that marijuana, cannabis, is legal for both medical and recreational purposes in several jurisdictions, it is more accessible than ever. The substance may appear safer due to its simple, legal access. Can weed make you depressed? Despite the fact that many depressed people use marijuana, researchers do not believe the drug is the primary cause of mood illness. Recent studies reveal that individuals with the illness use it to address their symptoms instead. One of the most typical reasons people claim they use drugs is to alleviate such symptoms. Weed depressant or stimulant? Weed as a stimulant. Is marijuana a depressant? Depressants have the opposite effects on the body as stimulants do. They frequently raise blood pressure and heart rate, which in some people results in fast breathing. Additionally, stimulants can elevate your mood, especially after taking them. Is marijuana a depressant? Stimulants make you feel alert and energetic, whereas depressants frequently make you feel tired or relaxed. They might also aid in lengthening your attention span. Additionally, stimulants can have harmful and perhaps dangerous side effects, such as increased body temperature, paranoia, irregular heartbeat, anxiety, seizures, heart failure. Weed is sometimes treated as a stimulant because it can cause elevated moods, racing heartbeat, anxiety, paranoia. Is marijuana a depressant? Tobacco has diverse effects on different people. After using it, some people can feel calm and at ease while others might feel extremely alert or nervous. Compared to many other stimulants, marijuana poses fewer hazards. Methamphetamine and cocaine are 2 examples of extremely addictive drugs that can harm your body and brain over time. Cannabis has the same dangers as depressants when used as a stimulant. Smoking marijuana can cause respiratory problems. And because it has mood-lifting properties, you may eventually develop a dependence on it. Does marijuana help with depression? Benefits of medical marijuana. Does weed help depression? Weed making me depressed. A 2014 study presented pain treatment as a potential advantage of medical marijuana in the Hawaii Journal of Medicine and Public Health. Participants in the study claimed that while consuming marijuana, their discomfort decreased by 64%. Many people who used the medicine also reported less anxiety and improved sleep. A 2012 study investigated the use of cannabis to reduce spasticity in MS patients. Participants had a 30% reduction in spasticity on average while undergoing this therapy. Additional advantages could include relief from involuntary movements associated with movement disorders, nausea, particularly from chemotherapy, sleep disorders, HIV-related weight loss. Research is ongoing in these areas to determine the short and long-term effects of use. Marijuana for depression and bipolar disorder. According to several studies, cannabis use can exacerbate the symptoms of bipolar disorder. However, additional research indicates that although negatively influencing some bipolar symptoms, such as concentration and memory, cannabis can positively affect others. The drug, for instance, is linked to greater rates of manic and depressive episodes. Begin with a free call to an addiction and behavioral health treatment advisor. Learn more about our dual diagnosis programs. The We Level Up Treatment Center network delivers recovery programs that vary by each treatment facility. Call to learn more. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.